Hi friends, viewers, welcome back to my channel, and my name is Gilbert and this is Safest Academy here in UAE, Dubai. Guys, you can see this is one of the best training institutions I've ever met in my life. Okay, so I'm one of the students, and today we are going to be practicing a lot of things. Okay, Safest Academy here in UAE, Dubai has a lot of facilities. Okay, and it's amazing how I enjoy this professional course CNN. So guys, today there are going to be a lot of practice. We're going to be doing range motion and also ablation, taking the patient from wheelchair, from the bed to wheelchair. So I just want you to stick at the end of this video and also watch. Okay, also watch it and also subscribe to my channel. Please guys, subscribe to my channel, okay, and also like and comment. Guys, let's go.
Ambulating, it is very important for us to know the techniques. Okay, know the techniques in transferring the patient, especially if the patient is it don't have head like that. Did you do that? What did you do with the patient? Okay, especially when the patient is unable to move properly. Okay, why do we need to ambulate them? Of course, as part of daily life living, we have to, to bring them out. Sometimes we need to bring them into the toilet, or maybe we need to bring them into the bathroom, or maybe we will put them into the this is what we call commode. What do we mean by commode? Commode is the urinal chair. Okay, it is where they will do the pass motion or urinating, but mostly pass motion or putting poops or getting out their poops. Okay, now whenever you will be ambulating the patient, there are things that you need to consider. First is that, can you carry them? Okay, can you carry them? In carrying them, there are techniques on how to do it. Because, for example, the NA is Joel and the patient will be Chris. It will be a little bit hard for Joel to do it, to carry it. But if you use the technique, then it will be easy. Clear? Yeah. Clear. Okay. Now, another thing that you need to consider is the height of the bed. Whenever you will be doing it, make sure that you know how to let him sit down. Unless you can carry him and then put it here. Okay? Unless you can carry. But if not, make sure that you will let him sit. When he sits, make sure that his feet is down. Okay? Because you will be supporting each other. You will be coordinating with each other. Okay? And in coordinating, you have to, I did not bring my, what do you call this one? Gate belt with me, but the gate belt is very, very important. We will just pretend that there is a gate belt. But on next week, I will bring it with me. I don't know if I put it in my car or in my bag. Okay, the gate belt. Okay? Okay. We will still be doing the things that we discussed last time, like the proper carrying. Remember? Knees to knees and then toe to toe. Okay? But some nurses do the patient will be here and then their toe will be here. Or their feet will be here to carry. But some nurses or some doctors do like this. Okay? Anyway, the important thing why we are doing this is because what? Is because we need to support our back. That's the most important thing. Supporting our back. Okay? Clear. Now, another thing that we have to consider is the position of our the wheelchair. The position of the wheelchair will always be at the strong side. The position of the wheelchair will always be at the strong side. okay, the strong side. So for example, come here. Yeah, of course, because you are the important person. Okay, you can lie down. Yeah, lie down. Release the. Oh no.
Now you can demonstrate that.
Good man.
Okay, and for example, the normal height of the wheelchair, the bed is this. Okay, this is the way you will be putting this up and putting it down. Okay, this one, it is in here. Okay, the normal is this one, but the problem is, how are you going to carry him? When you are carrying or when you are putting him into the sitting position, okay, make sure that it is at least at the height of your hip, because you will be carrying him. You will be carrying him. Okay? Clear? Now, let's see if I can do it. Okay? Like this. But don't forget, we always do the first thing that we are always doing, which is breathing. Okay, hello ma'am. I am here to ambulate you. Okay, okay, and then you will start carrying him. Okay. Now, this is the thing. How am I going to carry him? Okay, in carrying him, one of the best thing for us to do is to put something at this side, so that it will be what? It will be easier for us to move him. And it should be slightly, like for example, plastic bag or something. But there are some linens that is easily can be used. There are linens that can be used. Okay? Don't blame plastic, because maybe the patient will think that you will put him in the plastic. Okay. I will cut your head, I will put it in the plastic. Okay? So, what are you going to do? Make sure that you will put this up so that he will not fall down. Okay? And putting him up. Same thing as we are doing. Okay? I will put this one here. Just don't worry. Don't worry. Okay? Okay? At the count of three. At the count of three. 1, 2, 3. And there. And then put this in. Why do I need to put this one? 1, 2, 3. There. Okay? So that when I will be carrying him later, it will be what? It will be sliding. Okay? Now, the next thing that I will be doing is I need to put it down, because I need to support the back. Now, there are proper things, or there are several things on how to put him in the sitting position. There are beds that are not like this, wherein you can shift it into power or high power or sitting position. But if it's not, then you have to carry. You have to carry. Okay? But it will be the same procedure. Now, because the bed has the ability to do the Fowler, and okay, you will do this. This one best. I need to do this one.
Can you push? Yeah, that was what.
Okay. Joel, can you please do the other side? The other side, because this one is not working. There. Okay. Now, because the bed has the ability to adjust, we can adjust it. Okay.
Parang thanks.
There. Okay. Why is that?
So this is
Bed is like this.
seat leg position.
Wait, it should be all.
Like maybe this one is not
What
good.
is that?
Now
There's
it's
this
one.
one.
Nice
But
one.
it should be.
It's working that side.
It's
It
the
should
same
be full.
full.
Oh, okay, can you move again? I thought it's not working on my
You're
end.
going to pay Joel because he's here.
Yeah, don't worry, I will give you a plus 10. I can put this one. That is good. Okay, let's do it. There. Okay. This one is for you to easily put him up. Okay. Now, he's in a fowler position. Because he's in a fowler position, I can easily move him in a sitting position at this side. Here, can you give me the wheelchair? Right there. There. And then this will be the commode room. For example, this is the commode. You put it there. Okay. Now, the question is, how am I going to put him up? Okay. The first thing that I will do is to make sure, as I've said, that I will be comfortable enough in moving him. Okay. How will I do it? First is, of course, I will let him come here. One, at the count of 3. 1, 2, 3. There. Count of 3. 1, 2, 3. There. Okay, and then the next thing that I will do is to make sure to position my wheelchair in a proper position later. Okay, this one, this is my wheelchair. Now, I will let him do the sitting position. Okay, the first thing that I will do is to move him up. Okay, how to move him up? Put this one here, put this one here, and then at the count of 3, 1, 2, and 3. Now he is in a sitting position. Okay? Now, because in the sitting position, make sure that he will not fall. Because maybe there's a problem at the back or something. Okay, and then after that, you do this one. Okay? And then, at the count of 3, you have to rotate. But be careful in rotating because maybe he will fall down. Don't worry, the sliding is here, which means to say it's easier for you to, what? At the count of 3, okay? 1, 2, and 3. 5 what? Okay? Now because it's like this, if he can carry himself, then fine. Let him do like that, and then put it down. Why do I need to put down? Because his feet should touch the ground. Okay? Now let's touch the ground. If one nurse is with you, then you can tell the other nurse to support. Okay? If not, then do like that. But of course, you will not do like this.
His hand will
He can remove it. No problem. Okay? Because maybe he will not be comfortable. Okay, we are putting it down. Being a nursing assistant is a little bit tasking.
Yeah.
Okay. Is it touching? You're too small or the bed is too big? Okay, now it's touching. Now it's nearly touching. So when it's touching, maybe you can ask him, can you move forward a little bit, sir? Okay, there. Now it's touching. Now because it is touching, you can now put him into the wheelchair. Now, you have to know where the strong and the weak. As I've said, the strong and the weak. We have to put the wheelchair in the strong. Okay? For example, this is his strong side. You have to put the wheelchair here in this side. And make sure that when you're doing it, that the wheelchair is locked. Make sure also that your gate belt is with you. Don't worry, we will continue this next week. I will bring that gate belt with me. I will buy more gate belts so that we can use it. Okay? Now, because we are already, we are already here in this position to bring him here in the wheelchair. The wheelchair is already destroyed. Whatever. Okay, it's okay. Can you just hold it? Oh, yeah. Now it is already stable. Because it's already stable, I will do the thing that I taught you on how to transfer a person. Okay? Same thing, toe to toe, then knees to knees. Make sure that the back is straight. Okay? At the count of 3, we'll put it here. 1, 2. Okay, at the count of 3, 1, 2, 3, and then 1, and then 2, and then 3, and then sit. Okay? And then remove the gate belt. And then for privacy purposes, you will put the towel or anything that can be used.
Oh, Joe.
The head now is
He is jealous.
Why are you using Joel? When is it?
Because he looks like you. No. Okay. And then after that, you can remove and then bring him into the commode. Okay? For example, this is the commode. This school is very, very rich. Okay, very, very rich. They don't have they have complete facilities. Okay?
It will.
It's totally opposite from the school that I came from. Because the school that I came from, name it, everything is there. You are really like in a hospital. Okay, anyway, now because it is there, you will bring him in the commode. Okay, in bringing the commode, make sure it is, and then same thing, the strong side. Okay, the strong side. So for example, this is the commode. Same thing that you will do whenever you are putting the patient. Okay? Make sure that you will lock. Okay? Make sure to and then remove this, and then if the gate belt is still there, then fine. If the gate belt is no longer there, you have to put it. And then same thing, toe to toe, knees to knees, and then move up. Okay? At the count of 3. 1, 2, and 3, and then 1, and then 2, and then 3. Now, ask the patient if he can do it alone. If he cannot do it alone, can I remove your pants? Okay? Can I help you remove your pants? Can I help you doing these things and that? And then if he said yes, then fine, you have to do it. And then if no, then you can go out and wait. Okay? If he is inside, make sure that you have to observe. Maybe he is there for already 1 hour. Okay? And maybe in 3 minutes or 5 minutes, ask, sir, are you okay? Okay? Not, hey, are you okay? Huh? Sir, are you okay? Are you done? Or they will ring the bell. Ding, 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 ding. The one that they have there in the hospital. If the bell rings, which means to say everything is finished, then you will. What the hell? This one is with a curtain. Okay, this one is with a curtain. Why? Because it's not inside the toilet. It's a commode.
Yeah.
Commode. Or it's a commode.
Yeah.
Okay? Unless you will bring him in the toilet, then this is also the proper way. Any question? Any question? Okay, can you please go back here? Same thing, that you will be doing whenever you will put him in the. Okay, now in using this one, make sure also to put the pad later, whenever, because this one is destroyed or damaged. You have to put the pad with you, not him. Okay, you. You can use your feet, no problem. In fixing. Then once if it's done, then you can go with the ambulation. In doing the ambulation, there are things that you have to consider. First is, if this is straight, then you do the straight. 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 If you are going outside the door, then open the door and then backwards.
Yeah.
Okay? If you are elevation, if you're going elevation, going up, forward, but going up, but if you are going down, you have to backward. Okay? Backward. Because maybe going down and then you accidentally, what? Remove your grip and then he will go straight. That may cause accident. Okay? Is there any question? Any question? Next week.
Going up, backward.
Yeah, backward. Sorry. In going up, you have to move forward. Yeah, going up, you need to go forward. Okay. By next week, we will do all these things simultaneously. Maybe we will go out for rotation using this, and then maybe we will also go down. We will go down by next week. I will just be using my car. Ambulating from this one, going inside the car, or going inside the car, going outside. Is there any question? We need to know all these things because there are a lot of people who are wrongly doing it. One very important thing is supporting the head. When we are in Mamzar or in any park, I can see people who are ambulating patient, but upon observation, they don't know what are they doing. So it's very important for us as CNA to know the techniques on how to do it, because our main objective here is for the safety of the patient. You don't notice the head is already being banged into the window of the door of the car. But I can also see some high technology cars wherein the wheelchair has the backside, right? Wherein it's like an elevator.
Yes.
And then they will just push, and then this one, and then they can easily put the patient into the chair. Yeah. So like those things. So by next week, we will discuss further on this with the gate belt, and then we can do the roaming around with this. The same time, that will be our practical. Okay, is there any question? Any question? Okay, so we did a lot of things today. By next week, we will do a lot of things again. As I've said, don't forget to bring with you your PPE. Okay, your PPE, because I will put it in the
Sorry, what is
PPE is the gown. I will put it in the
Where is the gown?
if I will check if there is gown there.
Okay.
Maybe it's only 5 dirham, 3 dirham, 4 dirham. I think it's not that much for you.
So in case you
Yeah.
check, you do
Yeah. If it is not that much for you, then it's fine.
Yeah.
Okay? But don't buy very expensive. We have a
You
lot
don't know
of
where.
we have a lot of things that we need to consider here. Money is very, very precious and important. Okay? Any question? Is there any question? None. So that's all for now. The two person can leave for the practical. Okay?
Bestie and
Bestie and
Sandra.
Sandra. Yes. Yeah. Okay. Thank you very much.
So thank you, Baba.
Thank you very much, and have a blessed day to all of you. Okay, and then I think by the following days we will be doing some midterm examination.
You
It
didn't
will not
finish.
that much time.
You
Okay.
didn't finish.
That's
Clear?
Yeah.
Clear? Thank you very much. Have a pleasant day. Thank you.
Thank you, sir. Bye.
Yes, sir.
I'll put this one back up.
Please.
Another one.
Yes.
Give me a position.
Just this.
3.45. This is one. Non-weight bearing. Okay.
Oh, no.
4.8.
I need to practice this a little bit while I do so refresh my brain. What do you think?
Very refresher.
Yeah.
3.
It's on. So guys can see we are actually having to practice it. Very good. Each other.
Yes.
X lateral for 2.8 X lateral pivot.
Even gate contralateral.
Contralateral,
Together.
contra.
Yeah. Yeah.
Terminal.
Bestie, say something for us.
Where are you going to have the exam?
It was not with.
Because we have to beat you.
There was the second there.
Nothing to tell you.
The good one is inside.
You didn't